Welcome to the To Your Health podcast, your go to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred. Joining us today is Orthopedic Surgeon Dr. Lawrence Haydel. He is an orthopedic surgeon at Terrebonne General and Gulf Coast Orthopedics. Welcome to the show, Dr. Haydel.
Hello, thanks for having me.
Well, thanks for taking time out of your busy schedule to be with us today. Can you tell us a little bit more about yourself and your role at Terrebonne General?
Well, I practice at Gulf Coast Orthopedic Clinic. Been there since 1996, and I've had privileges here working at Terrebonne General since then. So I've been here doing orthopedic surgery with all the staff at the hospital, for the last 30 years,
Mm-hmm.
and been able to participate, with the care of all my patients at this hospital.
Okay, well, let's dive into today's subject, hip and knee replacements. I know you've done a lot of those types of
Mhm.
replacement surgeries. And then our Blue Distinction Award. What constitutes someone having to have a hip or knee surgery?
Well, they first come to us with complaints of pain, usually affecting their quality of life. So they'll come in with severe complaints of pain. We evaluate them to determine the cause of their pain.
Mhm.
And if it determines that it's arthritis, which is the main cause of having to have knee and hip replacements, we'll talk to them about the surgery and how it would improve their quality of life.
So, why did you choose to do orthopedic surgery?
I had an interest in it when I started medical school, but didn't really
Hmm.
decide till my third year when we did clinicals. I rotated through orthopedic surgery, and that's when I really decided to pursue a career in orthopedic surgery.
Do you have a family of doctors that
Yeah.
you are from? So,
Yeah, I mean, I always knew I was going to go to medical school, just didn't know if I was going to do orthopedics, but I really decided in my third year.
so you found the love for orthopedics
Yeah, that's
then.
when we did the rotations, rotate through different clinicals, and when I did orthopedic surgery, that's when I decided.
All right. I'm glad you did. So, the Blue Distinction Award, why is that so important for the community and your patients?
Well, it's a nationally recognized award by Blue Cross Blue Shield companies. They give this to healthcare providers who are show excellence in care. They measure different parameters such as quality of care, outcomes, patient stay, cost effectiveness. We do most of our patients on an outpatient basis now for total joint replacements, so that's been a big improvement from the past. They also measure parameters such as patient satisfaction and outcomes.
Hmm.
And I think this all gives patients an idea and helps them in their decision making in deciding to have a replacement and where to go and who to go with.
Right. Do you find that patients usually put it off until they can't stand the
Yeah, a lot
pain
of patients put
anymore?
it off for a long time because they're scared to have surgery, so they'll put the
Hmm.
surgery off as long as possible. Some do it sooner than others, but a lot of patients, once they have it done, they wish they would have done it sooner
Yeah,
because it helped them so much.
right. That's what they say, right?
Yeah.
So, what typically leads a patient to have a hip or knee surgery?
Mainly pain. They'll come in with complaints of pain. Again, it's affecting their quality of life, and that's what makes them seek treatment. So they'll come in to be evaluated. It's our job to determine what's the cause of the pain and what's the best treatment for it. That's the main reason they come in, and that's the patients come in to discuss that.
And how do you determine whether a patient is a good candidate for a joint replacement surgery?
First, examination, radiographic studies, and that mainly on the radiographic studies will determine the treatment. So we'll discuss that with them, and if it's affecting their quality of life, radiographic findings show severe arthritis, then they're a good candidate for a joint replacement.
What are some misconceptions that patients may have about hip and knee replacement surgery?
I think a lot of patients just scared to have surgery in general, so they'll they're scared of complication, bad outcome, and I think they just they just don't want to have surgery a lot of times because they're scared of that. Some patients need to be communicated with to give them guidance into how the process evolves.
What steps do y'all take to educate the patient before their surgery?
What's the discussion in the clinic with the patient visits first off, and go through the process of how we do total joint replacements, the postoperative period, they all scared to have the pain too. So we know you're going to have pain. We do blocks to help with the pain postoperatively. They're on medication. And it does require a lot of physical therapy postoperatively, to get the range of motion, the strength, and their mobility back.
What's the average age patient that you do this procedures on?
It ranges from the 40s all the way to 90 years old. I would say the average age is probably in the 60s and 70s.
And how long do they usually last?
Hips last a lot longer than knees, but we tell patients for the knees that they'll last probably close around 20 years, but they're lasting longer than that. I mean, I've been doing it 30 years and we revise very few.
Hmm.
And hips, we almost never revise hips. Hips almost last 30 plus years because they just don't get revised. And
Yeah,
knees,
that's
we
great.
revise occasionally for loosening or infection, but for the large part, they last longer than 20 years.
So how has the technology improved over the years?
The technique is basically the same, but the materials that we use have improved over the years. So it's kind of given an increase in longevity of these prostheses by improving the materials that we use for the joint replacements.
And what type of material is used?
It's a combination of stainless steel, cobalt chromium, and also a high polymerized plastic called polyethylene, which is used
Mm,
as a spacer in between the components for a gliding material.
okay, that sounds pretty high tech. But I guess it works and
It works,
it
yeah,
stays in place
yeah.
for a long time. So what is the recovery process like? Everybody puts it off till they absolutely can't stand it anymore. They get the surgery and then what's recovery like?
Basically, it's all about quality of life. When they know they're not going to want to live the rest of their life with the pain, and it affects what they do in everyday living, they decide to have the surgery. And in the postoperative process, it's physical therapy. We get them walking the day of surgery in the right out of the recovery room. They start walking. They go home that day, and we start physical therapy usually within a couple of days.
Hmm.
Uh, and they'll either do home therapy at first or outpatient therapy, and therapy goes on for up to 3 months. I tell most of my patients by 2 weeks, you're off the walker and able to drive,
Oh, wow, that's
which is about the
amazing.
average of most patients at 2 weeks of driving and off the walker.
Hmm. And do they have any limitations? I mean, at first they might, but then later
Once they
on.
recover, main limitation for both would be number one, we don't recommend any kind of impact type activity like jogging or sports like tennis, basketball, because that can wear out the component quicker. So we don't
Hmm.
recommend that. That's the main restrictions is high impact type activity. But they can do most things. Patients go back to golf, swimming, bike riding, and back to work. I've had many patients who work offshore who've been back working offshore or on boats, climbing up steps and ladders.
They want to get back to what they love to
Yeah,
do,
they can get back to normal activity
especially,
and work other than high impact type activity.
right? Work is important for a lot of people. So, how do you stay current with all the latest techniques?
We do continuing medical education courses, journals, speaking to our orthopedic company representatives. They'll present new technologies and new materials or equipment to us. That all kind of
Mhm.
helps us keep abreast of the latest techniques.
So, periodically throughout the year, you go to
Yeah.
conferences and things like that.
Yep.
How does it feel to restore somebody's quality of life back to what it used to be?
When the patients are very appreciative, it's satisfying, when you see how you improve their life because they get back to their normal activity that they couldn't do before. A lot of patients won't even they don't want to go shopping, they don't want to go on vacation because of the pain. And
Hmm.
when you see the appreciation they have for the quality of life you gave them back, it makes it all worth it.
Very rewarding.
Yep.
So, how many hip and knee replacements do you think you've done over how long, over 30-year career?
Well, I don't know. I mean, I would have to say probably do either between 150 to 200 per year
Wow. So, times 30.
times 30. Correct.
What's one of the most memorable cases that you did?
Oh, I don't. I couldn't think of that. I mean, there's so many.
There's so many. How do you help patients get over their fear or anxiety to have this surgery? What would you tell them?
Basically, with education and communication about the process and that the outcomes are very good. That 95+% of patients have almost complete relief of their pain. Some may have a little residual problems, but for the most part, the complication risk are very low. So educating the patients and communicating with them, I think, to give them a peace of mind that they're gonna do well with the surgery.
Do you let them know from the start at their meetings with you, like what to expect throughout the process?
I go through the process before surgery of from the beginning to end, how the process goes, and then they do meet with our nurse practitioners for pre-op education appointments to go through everything again, answer any further questions, and let them know the process that, what medications they'll need post-operatively, with mainly is pain medication and blood thinners. We do blood thinners on all these patients post-op just to prevent blood clots, because that's one of the complications.
So, what is the most important step that a patient can take to make sure that they have a successful recovery?
The main thing I think would be staying active, exercising, keeping the range of motion, and strengthening their joints, because that's going to help them rehab much better in the postoperative period if they have good range of motion and good strength before surgery.
Do you find that most people who need these replacements, like, is it because of wear and tear, just aging, or did they have like an accident or injury that caused them to have the
Some patients
procedure?
have accidents, injuries that lead to the degenerative arthritis. We call that post-traumatic arthritis, whether it's a fracture in the joint or if it's a torn cartilage or torn ligaments. A lot of these patients will develop arthritis at an earlier age because of the injury to the joint. Some people develop arthritis just because of genetics, especially when they come
Yeah.
in at a young age or even in the middle age, older, like in 60s or 70s, and they have a lot of arthritis on both joints, on both sides, then that indicates it's more genetics.
How can somebody, again, stay abreast of how to best take care of their hips and their knees?
Before getting to that point,
Yes, before getting to that
uh,
point, a little preventative measures.
yeah, I guess if it's hereditary in your genes, there's not much you can do. You're going to have arthritis as you get older, but preventing injury, keeping active keeping your joints strong, preventing injury. Patients who stay active and healthy tend to not injure their knees as much and won't have less likely to develop arthritic changes in their joints.
And if they do, they can come see you, right?
That's correct.
And you can take care of it. All right. Any final words you'd like to add?
I think we covered it all.
All right. Well, thank you so much for sharing this information with us. And it's good to know that there's a resource, a very valuable resource in our community that people can rely on for hip and knee replacements.
Thanks for having me.
For more information about hip and knee replacement surgery at Terrebonne General, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get podcasts. Thanks for joining us.